What about minimally invasive facelifting techniques? Well, I mentioned earlier there are multiple monikers for minilifts. You see minilifts advertised all over the place. S-lifts are another term that's thrown out there. Mighty mini lift I've seen out there. Minimal access cranial suspension, or max lift, MACS lift. The premise here, again, is to use a smaller incision, less dissection, less downtime, quicker recovery. I think these are all excellent, excellent things to strive for. In general, I think the results are less dramatic than with deep plane facelifts, as I mentioned earlier. But again, there may be certain categories of patients for whom this is just perfect. Interestingly, suture lifting can be used to target particular areas of concern. We can use those barbed sutures or other types of sutures to try to lift on that malar fat pad or the jowl area at the time of a mini lift to try to increase our results at the same time. Let's take a look at what a max lift might look like. With this type of lift, we actually don't make an incision behind the ear. We just go just slightly under the earlobe, kind of up into the hairline, do a little zig and a zag, and then we do our dissection out into the face. Maybe even not as much as this. And with some of the mini lifts or max lift procedures, we may target certain areas with sutures. We may throw a loop of suture around the malar fat pad and maybe one down into the loop, the upper portion of the neck, a loop into the upper portion of the neck, and kind of tighten those areas and try to maximize what we're getting with our mini lift. So it's a hybrid procedure using newer technologies, and we're trying to go for minimizing the amount of surgery that we're doing. So we've talked about multiple different ways of trying to rejuvenate the face. How do you put this together? Certainly, it's not the same as it was 20 years ago, where you had a brow lift, a blepharoplasty, or a facelift. You have basically 3 different options. You have multiple different options, things we can do in the office, things we can do with longer downtime and maximal result, things which we can do with less downtime and maybe slightly less of a result. It all depends on what your desires are and what the discussion you have with your physician is. For example, if I had a patient who came in and said, you know, whatever age this is, say someone in their 50s, who said, well, I've got these things going on, I do not want to have surgery. I want to know what you can do for me in the office today to try to freshen me up a little bit so I can go out into the world, and I don't want to have any downtime. Well, we may talk about doing some Botox in a few areas, like we talked about earlier. We may talk about Botoxing the glabellar area, taking care of some of the crow's feet out here, maybe even the forehead. Maybe putting some Botox into the the platysmal bands in the neck. And we may use some restylane or some other filler material to try to address the nasolabial fold areas, the labiomandibular folds, and the nasojugal fold. And with this treatment in the office, within about half an hour, 45 minutes, we can get a nice rejuvenation. Of course, the Botox takes about a week, as I mentioned, to take its effect. Alternatively, I may have the same patient, a clone of that patient, come in who says, you know, I don't mind having surgery. I would like to do something a little more effective than what my sister had, and I want to have something more done. What can you offer me that's sort of minimally invasive? I don't want to go for the whole blue plate special. Well, the endoscopic brow lift is a very nice technique for, as I mentioned earlier and I showed you earlier, for elevating the eyebrows and rejuvenating the upper 1/3 of the face. We may then talk about doing one of the different types of mid-face lifts, a cheek lift, a thread lift for that area, a percutaneous cheek lift, or an endoscopic mid-face lift to try to reduce some of the nasojugal fold and give a more youthful appearance to that area. Patient may or may not also elect to do a mini lift, one of the various different types we talked about, to try to improve the neck and jawline. So we have a number of different choices and combinations of things we can do. Obviously, there are actually an infinite number of combinations. Alternatively, the patient's second sister may come in and say, I want the whole thing done. I'm going to have surgery once. I'm going to get everything done. I want to maximize what I'm going to get. And we may then say, okay, we're going to do the endoscopic brow lift. I think that is a great technique and just as effective as traditional brow lift procedures. We may decide to do an upper and a lower blepharoplasty. The incisions are very acceptable. There's just some bruising associated with it, and we can really rejuvenate that whole complex very nicely with that procedure. We may do a traditional deep plane facelift to really get the maximum improvement along the jawline and the neck. So we have a number of different options depending on the patient and what the patient's desires are. And I often, spend a considerable amount of time actually gauging what I think would be the patient's desires, and we really spend a lot of time communicating and trying to come up with a plan that works for both of us. The bottom line with these minimally invasive techniques, and this is something I say in the office every day, is that they represent the latest advances in facial plastic surgery They're not all as effective as traditional techniques. Some are, such as the endoscopic brow lift, and some maybe not so much. Even the less effective techniques may be appropriate in certain circumstances. As I mentioned, we need to have a good rapport and talk about what sorts of things in downtime and so on are desired and what sorts of effects are desired, and gauge which would be the most appropriate technique. As new technologies emerge, and I've mentioned a few of them, not all of them will stand the test of time. And it's important that as physicians and as patients, we're really vigilant about this and take everything with a grain of salt when we see it on Oprah, for example. And at the very least, the new technologies which are emerging will add to our armamentarium of techniques which we have to offer our patients as physicians for treatment of the aging face. And I think I've given you a taste of all the different tools we have to offer patients who come into the office. And I'd like to thank you for your attention.